Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, tuning in through our online friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. As you guys have probably heard, cases of COVID-19 have definitely been decreasing. And with that, a lot of states are already being able to eliminate their mask mandates and other restrictions that have been in place. Some may wonder then, is it still important to get vaccinated for COVID-19 today? We're here to help us out with the answer to that and some things you need to keep in mind. We're excited to welcome Dr. Bhagy Navalkele to our program today of University of Mississippi Medical Center. I want to talk to Dr. Navalkele not only about the importance of being vaccinated, but also some important facts we need to know even if you've had COVID-19 already. Dr. Navalkele, thank you so much for the time.
Thank you so much for having me, Cyrus.
I'm excited about this. I'm on the radio side here in Mississippi where we have definitely also seen a decrease in cases. With so many cases decreasing, Dr. Navalkele, is it still important for individuals out there to get vaccinated?
Absolutely. That is a common question which we get from our patients and from the community as well. So thankfully, we are seeing that the COVID-19 cases are declining, but the case numbers are still pretty high. And so far, from 2 years of our pandemic experience, what we have seen is that unvaccinated population still remains at very high risk of having infection, actually 5 times more than vaccinated population. Unvaccinated people are 16 times more likely to get hospitalized, and unvaccinated people are 68 times more likely to die as compared to those who are vaccinated and boosted. What we have seen is that COVID-19 infection has been very unpredictable. So if you are unvaccinated, no matter what your age is or no matter what your health status is, you can get severe infection, hospitalization, and you could even die from COVID-19. So it comes down to vaccination, that it's very important that you get vaccination so that you can protect yourself against the worst outcomes from COVID-19. We are still not out of this pandemic. Hopefully we will soon be. And vaccination is the best way for us to protect ourselves as well as our community.
And I appreciate that. In my family, I've definitely been very concerned about my parents, making sure that they get vaccinated, myself being vaccinated. However, there are people who wonder, Dr. Navalkele, if they've already had COVID, should they still worry about getting vaccinated? What's been the answer to that question and concern?
Yes, Cyrus, that is again a question, and that is one of the reasons why people choose not to get vaccinated. So people who have had COVID, they do develop immunity, what we call natural immunity, which will protect them from getting COVID-19 infection. However, we don't know the details or we don't know how long that immunity lasts for. It also depends upon their severity of infection. If they had mild infection, that immunity might not last for a long time. So it's very important that what we know so far from vaccination, what we have been doing for more than a year now, that vaccination helps you provide a long-term immunity as well. So that long-term immunity helps to prevent getting reinfected from any other variants which might come through. What the data has shown so far is that unvaccinated population who had infection before and chose not to get a vaccine after recovery are still twice more likely to get reinfection as compared to those who recover and then choose to get vaccination. So again, vaccination still remains a key way for us to help prevent any reinfections in the future and provide long-term immunity.
This brings up an interesting question, though, because we've seen in the news, of course, about Queen Elizabeth testing positive for COVID. It's been reported that she was vaccinated and had gotten her booster. Some will wonder then, why should I get vaccinated if it's not effective in stopping people from getting the Omicron variant that's been so prevalent? What have you been telling people when it comes to that, Dr. Navalkele?
Yes. So the vaccination helps protect against the worst outcomes of COVID-19. Even if you are vaccinated, if you get exposed to someone who has COVID infection, you can catch the virus. However, your symptoms or your manifestation of the disease is going to be less severe. You are less likely to develop severe illness. If you are vaccinated and boosted, you're less likely to have hospitalizations and you're less likely to die. And if, those people who are vaccinated and boosted, they are also less likely to transmit the virus. So with vaccination, you're protecting yourself. You're also protecting the others around you so that you're not transmitting the virus to them. That's why it's important that you would get, even if you catch the virus, you're not going to develop any of those severe outcomes or bad outcomes which are associated from COVID.
I want to ask you this question, Dr. Navalkele. When it comes to individuals out there who, you just mentioned the vulnerable population, I'm concerned about that myself when it comes to my parents. How can we then avoid getting and spreading COVID to those vulnerable friends and relatives, especially with so many of these restrictions being lifted?
Absolutely. And I share the same concerns with you. I worry about my parents, my grandparents as well. So the best way what all of us can work towards is, one, certainly getting vaccinated, if we are vaccinated, if our parents are vaccinated and boosted, grandparents and everyone in the family is vaccinated, there is less likelihood that there will be severe infection within the family. There will be less bad outcomes as well, and there will be less transmission of the virus as well. And this applies to community. Each and every family, if they replicate this, there will be less infection circulating within the community. I know masking, in some places masking is coming away. However, it is important that you continue to mask, especially if you are vulnerable population who can be at risk of developing severe disease. Then it's important that you continue to mask when you are in a public indoor setting so that you don't get exposed and you don't catch the virus. And the other important thing is getting tested. As soon as anybody develops symptoms, which could be like cold or flu-like symptoms, it's important that you get tested immediately so that you can start your isolation and prevent that spread of virus among your family members.
We're hearing more states talking about learning to live with COVID-19 in Europe. They're talking about the same thing, entering a new phase. What does the future look like, in your opinion, then, when it comes to COVID and for Mississippi and the country?
Yes. So that is a hard question. That's a very unpredictable future. We don't know how the future is going to look like. It's very difficult to say right now. But we are really hopeful that we are going to start seeing less virulent strain of this virus. So the Omicron, after Omicron, hopefully there is no new variant which is more transmissible and causes severe infection like Delta did. And if that happens, then we will still continue to see surge in cases, but hopefully we don't see that happening again. It is certain that we are going to have to live with this virus. It's not going to go away, but it is going to become a part of our life, just like all the common cold viruses and flu virus is. The best way what we can do is that we can improve immunity within our community, so that helps to decrease the spread of virus, and that helps prevents new variants from emerging. So more in the community, within the population, if there is natural immunity or vaccine-induced immunity, there is more likelihood that we are going to start seeing the virus, new variants going away, and that the virus becoming endemic, and that we can live with the virus. And this needs to happen not just on the national level, but it needs to happen across the world. More people get vaccinated across the world, the more likelihood that we will see a earlier end to this pandemic.
Some great information for us. Really appreciate you stopping by. Again, everyone, Dr. Bhagy Navalkele has been our guest of the University of Mississippi Medical Center, talking with us about the importance of being vaccinated. You all can find out more information by going to vaccines.gov. Again, that's vaccines.gov. For our online audience, we'll link that up for you all as well. And Dr. Navalkele, thank you so much for the time. Really appreciate it.
Thank you very much, Cyrus.
And we thank your audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.